So the movements that I'll be going over here with you guys is going to be part of our treatment and the rehab program, but all of them can be also used at home as well too. All of you, or those of you who are the patients here, are doing the regenerative medicine treatment. We're helping you reduce that level of the pain. So the question that we get asked all the time is, what now after I'm done, right? So the movements and the exercise that I'll be going over with you is going to help you protect your investment that you have made here, okay? So look at that, check out that leg here.
What do you desire to do if your knee pain weren't holding you back? Would you go for a walk? Would you go dancing again with your partner? Envision a realm where the burdens of discomfort and pain no longer hinder your life and hold you back. Chase after your grandchildren. Go on the dream trip. Play games of tennis and golf again. Cast aside the conventions that constrain you. At your core lies an untamed yearning. Don't let anyone tell you you are old. Or dare to call me okay, boomer. You are the greatest generation. So what do you desire to do? Your knee pain weren't holding you back.
Let's get started. So again, my name is Dr. An, and in case you didn't know, I am the clinic director of this place. The treatment and the protocol that we use was developed by me. I spend most of my time now doing research and development, always bringing the best treatment that is out there, the newest treatment that is out there, and we're always constantly improving our protocols and the treatment. And this workshop is also the result of that research and the treatment. Look around this room here, majority of our patients are senior citizens. Last time I did the count, 72% of our patients were 67 and older, okay? So before I go over these knee movements with you guys, I wanna start this workshop by, with the riddle by the Sphinx. You have heard this before, right? Sphinx asks, what goes on 4 feet in the morning, 2 feet in midday, and 3 feet in the evening? Who has heard of this and who knows the answer? Really? Wow. Answer is man, right? So I just turned 49, by the way. Okay, and I am becoming the age of my patients that I take care of right now. One thing that if you didn't know about me, I actually had my first child when I was almost 45 years old. Yeah, and that was with the help of stem cell therapy. I can talk about that in another time. But I'm 49 years old. I have classmates who are mostly grandparents, but I have a 3-year-old and an 8-month-old at home. So when I go home, I look at literally babies and toddlers. And when I come to work here, I see you guys in here. So I feel like I'm right in the middle, being able to see the very young and the very old every day. So I grew up in Korea. And there's a Korean saying, like I think it was like a Korean acupuncturist who told me when I lived there that energy, or you've heard of the word chi, right? It's the life force and the energy. From the time we're born to as we get older, they move from your feet to up. So when I'm changing my baby, he or she, both of them can't keep their feet still. They're rocking, and they're always moving around because all their energy is concentrated in their feet and their legs. But as we get older, what happens? That energy moves up, right? So as that energy moves up, what happens? We tend to not move our legs. We prefer to sit down. We prefer to be sedentary. And when that energy moves up, they tend to end up in your mouth. So we like to sit around and talk and gossip and eat. Okay? So how do we counter that? How do you counter that?
Exercise.
Get off your butt and move, right? Stop eating so much and have a lot of quiet, reflective times. Okay? So with that, and if you think about it, this is why as we get older, we get heart attacks and strokes and things happen up above, right? Because all this energy tends to move up as well too. So there are two simple laws of human body. One is what doesn't kill you will make you stronger. That's how our immune system works. If you get sick with an illness, you're not likely to get that same illness again. If a bone breaks and it heals, that bone will build a callus and become really strong, and you're not likely to break that bone again, okay? Second is what you don't use, you're gonna end up losing. So as you get older, you don't move your legs and knees. You prefer to have more sedentary lifestyle. You prefer to sit. So your joints, ankles, knees, and hip, what's gonna happen? You're gonna lose it. Yeah. So number one and the easiest way to tell whether you have knee arthritis before you go see any doctor is if you can't do this and touch your butt with your foot like this, if you can't do that, that's a pretty good indication that you're developing knee arthritis. And that is the reason why you guys ended up here. Okay? And not necessarily just by not having a sedentary lifestyle, but also it could be triggered by some kind of injury, old injury, it doesn't heal, or it could be, sedentary lifestyle, and a weight gain is another big one, right? The heavier you become, the more difficult it is, and you just don't feel like moving anymore, okay? So, I discovered this guy who has put out this amazing knee rehab program. His name is Ben Patrick. He's got a thriving Instagram account and YouTube account. And a lot of his demographics of the people are like CrossFitters, young, very, very like super athletes. So, but he does have a really good knee rehab program, and I really liked it. So I said, that should be incorporated into our care program. And I actually contacted him, and I think his mom is his manager. And she was delighted to hear from me. But when I did asked her, is your son's program suitable for my overweight, deconditioned senior patients? And the answer was resounding, no. So I took his program and took a little bit of time to modify it to apply to my, overweight, deconditioned senior patients, and that's what we're gonna go over. And really, there's not that many movement. There are just 3 or 4 of them. Okay, it's that guy. And by the way, the guy in green shorts, he's had a partial knee replacement because he was a professional athlete. He's had a lot of knee injuries, and the doctors told him you'll never be able to bend your legs or be active again. And with the program that he's developed and the studies that he's done, he's able to do that now and teach thousands of other people how to do that as well. So, time for your workout. I forgot to bring it out here. If you go to my office in room number 6, there is a rubber band. Okay, box of rubber band. So, number 1, I'm going to be going over three movements with you guys, and these 3 movements should be done number 1, what is called knee flossing. So we're not talking about flossing your teeth, but it is kind of like that, because what you're going to do is use a very flexible rubber band. Yeah, you can just leave it out. I'm going to need scissors as well to cut it, okay? And you guys can go home with this, by the way. So you're going to, this is not, by the way, knee bracing. It's different than knee bracing, okay? So all this movement that I'll be going over with you, you're going to do it with your knees flossed, okay? So I'm going to go over a cool video that I found here, how to do knee flossing. Okay, so we got empty chairs that you can put your foot, pair up, because we're gonna floss your knees, okay? Are you guys able to help me? Yeah? All right. So what's the purpose here? You wanna make it tight enough to slightly cut off the circulation. So when you engage in those movements with the floss the knee, and then you let it go, what's gonna happen? You're gonna get a rush of blood flow in there. And it's gonna feel very good. Okay? All right, so let's go ahead. There you go. Go ahead and start. Pair up, pair up. Get a partner. Yep, all right. Yeah.
Everyone should get one.
Yeah, everyone should get one. Yeah, you get to go home with it, okay? Extend your knee. There you go. Oh, make sure Miss Dickby gets 2. Yeah, for both knees. Yeah. Yeah. You're starting a little too low. Just a little bit higher, okay? Yeah, a little bit higher. Just
You
below.
almost want to go like right where a knee
here.
brace would go.
Yeah. Yeah, demonstrate.
Yeah.
See. Yeah. That's a little too short. There you go. There you go. Okay, give me one. I'm gonna work on this, Mr. Arthur.
Who does not have one?
I thought you were gonna.
Me get one. You guys
I thought you were gonna bring your girlfriend.
My wife.
Oh, your wife.
Yeah.
Oh, sorry about that.
That's all right.
All right.
My wife doesn't know about my girlfriend. Just kidding.
Scooch forward a little bit.
Oh.
So you should be able to do it on your own. It's not too difficult. Just like that. Yeah. It's a
Played
little.
hockey for years.
You played hockey?
Ice hockey. Yeah.
Oh, really?
Minor professional.
Oh, really? There we go.
Well, that's
A
great.
little short here. But, oh,
I'm a little short.
yeah, your leg's a little bigger than what we would do. Here we go. There we go.
Cool.
All right. So I think you cutting them a little longer.
Short, we can cut them longer.
Yeah, we can cut them longer. I think you cut them a little too long. Yeah.
But we need longer from here.
Can you grab an empty chair? Yeah.
Oh, there is one?
Yeah. If you can take a lot of pictures. Yeah, a lot of pictures. Okay. Yeah. Keep it going. Okay. Yeah. Give me a long one. I'm gonna help out this lady right here.
1 second, we're
Yeah.
referencing here. If you have more
There you
tissue
go.
on your knee, you need a...
There you go. Thank you. All right. Keep your knee straight. And keep your knee straight. You can? All right. I'm gonna just set it this way. Start from here.
Thank you.
Oh, yeah. There you go. Just like that. Okay? All right.
Hey guys, a really, really good tip before you start is to have it rolled up already. So if you kind of want to pre-roll it, hold on. And it can be loosely rolled. It doesn't have to be tight. So then when you put it on,
Okay.
you put the
So
flat
let go.
side
Let go.
towards
Let's
the
do.
leg, like so, and then you're not
So,
feeling
yeah, let's take this one up.
Okay.
Let's keep that one up. Yeah. There you go.
I would maybe start a little bit higher, like start a little bit higher here, so that it goes a little further. Yours looks good. Feel okay? It's tight, huh?
All right.
It's wild as hell. It's wild.
Can I do my top?
Yeah.
Yours is too short. Can I get a long one? Yeah, I'm gonna rough it up.
Feels good, right? Feels good. Yeah. Yeah. Okay.
Yeah, that's a.
Are you a
You know what? If your knees floss, stand up and see what that feels like. Yeah. Feels good, right? Okay. Oh, that one's coming off. Okay. All right. Okay. Feels pretty good. Try to bend that knee like you saw in the video as well. Okay. Yeah. Yeah. Okay, so I think most everybody's all flossed now, right? So from here, there are just the three movements. Don't fall in here, right? There are just three movements that I need you to do with your knees in a flossed position, okay? So number one movement that you can do, okay? Yeah, have a seat. Number one thing that you can do to protect your knee, strengthen your knee, get you to be out of pain, make our treatment here work better is walking backwards. Okay? So I remember I told you I grew up in Korea, and I've seen videos from China as well too. Asian countries, older people, they walk backwards when they exercise, okay? Because it's going to engage your muscles and ligaments in a way that they never get engaged when you're walking forward, right? So the question becomes, how do I walk backwards in a park and will I run into people? You can do it on treadmill as well too. So who here has a treadmill at home, right? About 1/3 of you. You can buy what's called a non-motorized treadmill. These are treadmill that is not powered by electricity, but treadmill that is powered by your own movement, okay? Even if you have a motorized treadmill at home, don't plug it in, don't turn it on, all right? And you can just use your legs to power it to walk backwards, okay? As a matter of fact, for most of you, walking backwards when the treadmill is turned on is gonna be dangerous, all right? So don't turn it on, keep it off, exactly right. Don't turn it on, keep it off, and I'm gonna show you here what that looks like here. We do have a motorized treadmill. I'm not gonna turn it on. So, number one, everybody, if you can just kinda, all right. So, this is not turned on, okay? What you wanna do is kick up the incline of the treadmill. So you want it in a more inclined position, not a flat position, okay? So you're going to, of course, hold on to this right here, like this, and you're just gonna power it like that, okay? 10 minutes, 3 times a week. Who wants to give it a crack? Let's try it, yeah. There you go. There you go. Yeah, it's powered by you, so it's kind of hard to... You can keep it on, but you don't have to, okay? You don't have to, but you can keep it on. How'd that feel? Yeah? Okay. So 10 minutes, 3 times a day. By the way, this non-motorized treadmill, you can buy one off Amazon for like $140-something. They're inexpensive. Okay, so it would be a very nice investment for you to make. Someone else wants to give it a try? Let's do it, yeah. Let's do it, yay. Yay, let's do it.
Is it 3 times a day? Or
3 times a week, 3 times a week,
Okay.
3 times a week, yep.
3 times a day.
3 times a week. There you go, you're doing it, sir. Like my 3-year-old would say, you're doing it. Okay? All right, feels good, right? Yeah. All right, so the next question becomes, you can get off. What if I can't walk? I can't even do that. I can't stand, right? You can do exactly what I just went over sitting down. So this is why we have one of this right here. It's light because you have to start somewhere. Everybody agree?
Yes, ma'am.
So sit because you have to start somewhere. You want to give it a try? Let's do it. Yeah. Yay, let's do it. Oh, here we go. There you go. There you go. Kick it. There you go. Yay. All right, you can do this, right? Yeah. Because you have to start somewhere. Oh, this is why. Okay? So what's the number one? Movement, walking backwards. Probably one of the best thing you can do for your knees and your hip joint as well too. Okay? All right. You can sit. Number two, what's called a toe lift or a muscle that gets neglected all your life. It's called the anterior tibialis muscle. That attaches to your knee joints, attaches to the end of your kneecap as well too. So how do you strengthen and exercise that muscle? I see her taking her shoes off. So the easiest thing you can do is just to sit and then lift your toes up like this. Okay? Yeah? See if you can extend your legs. Extend your legs and lift your toes. Lift your toes. And you know what? Hold it for 2-3 seconds and let go. Really contracting that muscle, okay? See if you can get your legs out like this. And relax and pull it up and squeeze that muscle. Squeeze that muscle. It's what we commonly call the shin muscle. Okay? So lift your toes up and squeeze that muscle right there. And let go. Lift. And let go. Okay?
The ball with the foot.
Yes. So, if you are more mobile and you're telling me I can do better than that, now you want to do that while you're standing up. Okay? So just like how this video is showing. So here we just acquired a machine that exercises the anterior tibialis muscle, and this is called the tip bar. So those of you who are currently under the care now this is going to be part of your treatment plan. You're going to be putting up your foot here like this, and then lift it like that. Okay? So you can do a standing up like this. I'm already getting sore. Do you realize it has the ability to put weights on it? Oh yeah. We're not going to do it because y'all can handle it, okay? Y'all can handle it. We're not going to put weight on it. Because I was like, let's wait until it gets here. I want to see how the big ring is so I can put up maybe 2-3 pounds. No, it's okay. You guys don't need it yet.
You don't need it.
Yeah, you don't need it because doing it without the weight is challenging enough for me to make me sore right now, okay? So, let's take 2-3 volunteer for you to sit and try it, okay? Come on. Let's see. Let's actually bring it here like this.
We can pass it around.
Yeah. Well, I don't know about passing around, but you can come out and try it. Let's do 10 each, and you really want to squeeze and hold that muscle right there. There you go. You feel it, right? We don't need weight. You agree, right? Yeah. But if you don't have these tip bar, by the way, I ordered it in August and it just got delivered like yesterday. I emailed them multiple times like, I want my money back, you know? But, all right, so you don't have one of these things at home, just like what the video showed you. Just lean against the wall, put your foot out, and then just keep lifting your toes like this. Okay, again, yes, it looks super easy, but you have to start somewhere, right? Everybody agree? Okay?
Yes.
want to really squeeze that muscle right there. That is the muscle that is neglected all your life, contributes to the knee instability, that contributes to facilitation of osteoarthritis. Okay? Yeah? All right, let's have a couple of more people give it a crack at it. Yeah? Try? Yeah. What you don't want to do when you're doing the toe lift is, if that muscle is really weak, you'll try to do that movement by recruiting other muscles, like moving your hip, or you're lifting your hip right now. So you want to keep that all still and don't recruit any other muscles but that shin muscle. Okay? So, see if you can do it. There you go. Okay? Yeah. All right, very good. So, what's today? Friday, Monday. This is going to be all set up. If you're currently under our knee program, you're going to spend 10, 15 more minutes in here doing these rehabs with us. Okay? All right, very good. Any questions so far, by the way? I just have one more.
The problem is just for the one week.
Mm-hmm.
You suggest you do FOs.
Yeah, why not? Okay? You don't want to wait until the other knee becomes, so you don't want to wait, right? So, and then lastly is the squatting. All right? The greatest challenge for a lot of you in here, okay? So, I told you that I grew up in Korea. In Asian cultures, we have floor cultures. You guys have a sitting chair table culture. We have floor culture. So, hi. Yeah. So, I grew up sitting on the floor, eating on a low table, right? Studying on a low table. So we're super used to squatting, right? Which contributes to our flexibility as well. Who here has watched the Live to 100 docuseries on Netflix, right? So what was some of the common things that all these people had? Movements, right? They lived in an area or part of the town where basically the moment you walk out of the house, you're forced to what? Walk to everywhere, right? So, squatting is probably the most important thing that you need to be doing and working on. And I also know a lot of you can't. But what do I keep telling you? It has to start somewhere, right? So, he's a physical therapist, found this video on YouTube. So he's going to go over in a few minutes how to introduce yourself to squat, because you have to start somewhere, okay? Who here can actually do the full squat? Yeah? All right, well, that's good. A couple of you in there, a couple of you who are not patients in here. All right, so starting with the chair is a very good idea. I got this from Amazon. It was like under $50. Yeah, it was under 50. I mean, these things are incredibly affordable. Okay, so if you want, you can get one of these. If you don't, then you can start with a chair. Just like the guy is showing you, okay? You have to start from somewhere, right? So start squatting, right? I mean, it's, who wants to try? Yeah, let's try, yeah.
Let me try.
How far you can go? Yeah. That's good, yeah, that's pretty good, yeah. Who wants to go lower?
Anybody
wants to try? Stick feet? Yeah, let's try it.
There's a limbo contest.
Down, my king, come on.
All right. Well, look at that. Yeah. Eventually, you want to do a repetition of 5, 10. Your goal is to go lower And your goal is to get your legs to be strong enough for you to come up without the support. Okay? So I know for a lot of you that sounds rather daunting, right? But what I keep telling you, it has to start somewhere. You know why you are where you are today and ended up being a patient in here? Because over years and years and years, you have neglected to care for those joints and the strength and the legs, right? So these four things I went over with you, it's not going to restore you tomorrow. You guys understand that, right? Mm-hmm. So it's the small, consistent steps and the actions that you don't give up, that you continue on doing, will get you to be stronger again and get you to be able to walk for the rest of your life so you can continue to live a good quality of life. Okay? So don't give up. I can only do 2. I can only do, I can even do 1 squat, but don't give up. If you set up a goal, I want to be able to do 10 squats by Friday when you can barely do 2, you're setting yourself up for what? Failure. Okay? So, and this concept applies in everything you do in your life. Consistency is really the key to the kingdom. So you don't take vitamin for 1 week and be done with it. You don't exercise for 2 weeks and be done with it. It's doing the small things consistently and not giving up. A year later, 2 years later, is going to give you a huge return. Okay? So with that, let's see. In review, floss your knees. You get to go home with those rubber bands. And do these movements with your knees flossed, if you can. Okay? Walking backwards, 10 minutes 3 times a week on a treadmill in an inclined position. And don't turn it on. You're just going to power it and muscle it with your own legs. Toe lift or anterior tibialis extension exercise. And work on squatting. Okay? There is a well-known test. And if you're over the ages of 50, this test, I'm almost there, okay, by the way. This test can predict your rate of mortality within a certain year period. And that test is called sit to stand, okay? I don't know the details of how the years come about, but it's basically, you do a test by sitting down, and then you get up. Wow.
Easy for you.
Hold on. The more contacts you make to get up, you can predictably predict your mortality if you're over the ages of 50. Google it. It's a pretty well-known test. It's called sit to stand test. Okay? So what?
More contact?
Contact. So for example, from here, there's a contact 1. There's contact 2. There's contact 3. And if you have to hold on to things, the more contacts you make, your mortality goes up substantially. And there's years and numbers that you can look up. I mean, I don't have those numbers in my head. Okay? But really, what is that test trying to tell you? Yeah, if you're going to work out your legs. Because it directly relates to your what? Longevity. Longevity. Okay? Remember I told you 72% of our patients are 67 and older. Almost 80% of our patients have about 40 pounds of weight, excess weight. Okay? You do realize knees and hips and lower back, they're weight-bearing joints. So the more weight you carry, what are you doing to your joints? Just carrying more load. Okay? So this is a study that came out not for regenerative medicine or for people who had to go through knee replacement and knee surgery. And the magic number that increased the success of the knee replacement surgery was 20 pounds. And the interesting thing was if you could lose 20 pounds before the surgery, and you get the surgery, and even if you gain some of that weight back, these people still had a better outcome than people who never lost that weight. Okay? If you have to get a knee replacement or any kind of hip lower back surgery, and if you have the excess weight to lose, a good surgeon, good conservative surgeon that has your best interest in mind will tell you to lose weight before I can do the surgery. I used to see that, but I'm seeing less and less of that now. Okay? I have a young lady, 24 years old. She's morbidly overweight, and she was suffering from back pain. This is why who you go to, the first doctor you go to see is super important. She went to an orthopedic surgeon who recommended, of course, what? A back surgery. Was not successful. She's in severe debilitating pain. She goes back to that doctor. Guess what happened? He performed another surgery. That was not successful. And guess what happened? She goes back to the same doctor. I'm still in pain. Another surgery. Yeah. So she's 27 years old. Already had 3 back surgery. Life ruined. Can't work. Can't do anything. So, when patients do come in with failed surgeries like that, it does pose a lot of challenges for us because they just come in with so much damages, okay? But even if you're not getting a knee replacement, and by the way, congratulations for being here to avoid that, knee replacement surgery. But while you're in here, if you can lose about 20 pounds, it's gonna make our treatment work better. You'll be doing more to protect that investment that you're making on your own health, okay? And that is if you do have that weight to lose, okay?
I lost 16 already.
I weigh 13 already.
All right. So as much as I'm not a fan of prescription medicine, you guys heard of the Ozempic and Wegovy, the weight loss injection? So we've had various different types of weight loss programs in here. Seriously, God, everybody's losing weight under the program. It's kind of crazy. So if you have seen my old videos or any kind of contents that I made more than 2 years ago, I don't know if you noticed I was bigger because I was always 10-15 pounds bigger all my life that I could never lose. And then during the pandemic, I put on another 15 pounds.
Oh.
So I became officially like 20 pounds overweight. And then I told you I became a first-time mom at 45, and my A1C came back 5.8, which officially made me pre-diabetic.
Yeah.
So I told myself, I'm not doing this to my kids. Okay, so I lost almost 30 pounds in the last 2-year period. I did it slowly, using the same concept that I discussed with you earlier, which is doing it consistently and not giving up and just keep doing at it. Okay, I have been taking underwear pictures of myself for personal use. Like in the morning I get up, get on the scale, and just take a underwear, not bikini shot, underwear pictures. Mm-hmm. Do you want to see it? Yeah?
Are we allowed to?
I may have to charge you. All right?
Wow.
Yeah.
No,
I
it's
know.
perfect.
Yeah. So that's done in over. I'm actually a little leaner than this now because I have about last 10 more pounds to go, and mostly just here. Okay, but you would have never guessed that my tummy looked like that because I'm a small, petite person, and I don't like tight clothes, so I will always wear baggy shirt, and I still do. But you will be shocked. Like my waist was almost 40 inches, almost 40 inches. I'm only 5'1". Okay, so those of you who are interested in the weight loss program, yes, sir.
And why you change on your diet? I mean,
No, I did change my diet too.
like
Mhm.
like what?
What you was eating before and now, what you eat now?
So that's by the way, who wants to come to next class, which I'm gonna talk about how to do this and reduce weight and reverse your diabetes. Yeah? In another 2 weeks. I have to just put another 2 weeks.
Okay.
So we're gonna talk about all that. That's a good question, okay? My father's side doesn't have diabetes. My mother's side is riddled with diabetes. I have an uncle, in fact, who died of complication of diabetes, and unfortunately, that gene tends to like to get expressed in me as well too. So, I can teach you how to do that. We see it here all the time. People lose weight, diabetes improving, neuropathy going away, ED improving. You know, try not to stare at any male audiences in here, but. I can teach you how to do that. That's gonna be in 2 weeks. I just have to, check my calendar on it. And it's surprisingly not that hard to do. And despite what you might have been told by your doctors that type 2 diabetes is not reversible, that's not true. American Diabetic Association had the definition of type 2 diabetes as something that goes something like a irreversible illness, blah, blah, blah. About 2 or 3 years ago, they actually removed that word. Okay, so it's not that hard to do it, and if you want to do it, there's a whole lot of information on the internet too. I have read about 7 books on it, watched a lot more videos on that topic, and I can compress it in 1 hour class for you guys to do. Okay, any questions so far? Was this a good class? This is being recorded, by the way, so it's going to be released on our YouTube channel for you to go and watch. And I can also make a PDF downloadable file as well too. The semaglutide or the weight loss injection, if you do the Wegovy or whatever, number 1, your insurance will only cover it if you're officially type 2 diabetic. And soon as that A1C comes down, they're gonna quit cover for it. And it's all like it's a $995 to like a $1,500 depending on for 1 month of supply. Okay, so for those of you in here or for our patients only, we have a special pricing for semaglutide injection, which is $495, and for 3 months, if you prepay for it, we have an additional discount as well too. If you're interested in that, you can schedule an appointment with Emily, or is Jennifer here? Jennifer, you can schedule an appointment with Jennifer as well. Those of you who are not a patient, you're interested in our knee program, we can also arrange a complimentary evaluation for you as well. Okay? So please speak to Jennifer when you're done. And that's all I have for you guys. Yes.